So everybody, I want to welcome Amanda Rayhel from Somebody today, and she's going to go over some of the things that she offers here in town and some of the things that you actually can get a discount on. So let's go ahead and dive in. And Amanda, why don't you just give us a quick introduction of who you are, what you do, what your background is, and then we can dive into it from there.
Yeah, yeah. Thanks for having me. I am Amanda Rayhill, and I am a registered nurse, and I own Someday Wellness LLC. I have been a nurse for, gosh, been almost 16 years now. Majority of my nursing career has been in oncology and infusion nursing, so I've done that my entire nursing career. I worked in a outpatient clinic in Omaha for 4 years, and then the last about 10 years, I ran the infusion center at St. Mary's Hospital in Nebraska City. So I did a wide variety of infusions. And about 3 years ago, I decided to take my nursing outside the hospital walls, try to approach things in a more holistic type way and help educate people in wellness, being really proactive in their health versus being reactive and focusing on the sick part. I wanted to be able to, promote health and wellness. So it was scary leaving the hospital, but it's been very rewarding and exciting. So I just kind of trusted the Lord of what was being presented to me. And so I started doing a lot of IV vitamin hydration therapy. And I teach at the gym as well. So I try to really lead by example as well. So that's kind of what I do. Again, I like to do wellness coaching. I do a lot of online coaching. I teach at the gym, and then I do IV vitamin hydration and injections and things like that. So,
So when we look at the IV therapy, what type of offerings do you have? Who is
yeah,
this good for?
yeah, I feel like we have a wide variety that we're able to offer. Today, I just did a simple hydration on someone who's been feeling dehydrated, not able to drink a lot by mouth, which I feel like most of us probably walk around being dehydrated and we just don't even know it, but our organs are like, we need the hydration. I think typically, people feel like they're dehydrated when they feel thirsty, but that's kind of a late sign. So, being hydrated is, just that simple hydration, but we have energy bags if you're looking to boost your energy levels. I've been giving a lot of immune support infusions lately. So, immune. I have an athlete's bag. Work with some MMA fighters who, put their body through the ringer, looking to improve their performance. Mental clarity. We have some amino acids that can help speed up metabolism. So somebody that's working on weight loss goals. What else? I feel like we have so many. I have a prenatal bag. So, for mamas, wanting to keep themselves healthy, hydrated, and support baby during pregnancy. We have a prenatal bag. We have a migraine IV bag, which I think is very beneficial. Coming from the hospital, I know a lot of people would end up in the ER trying to combat migraines if their meds at home aren't working. So we have that option. And then we also have some injections. We do injections as well, like your B12 injection. But then we offer things like NAD, which can help DNA repair. We have some medically guided weight loss, like your semaglutide, tirzepatide, and we also have Somorelin, which is a peptide that's really great that helps your body produce its own human growth hormone. So I really like that one too.
No, you got some cool stuff there, and you actually answered one of the questions I was going to ask you. Is one of the questions that always comes up on this is it IV? Is it a push? Do you have the option on that, or how long does the typical one take?
Yeah, so we do IV, and this is kind of a gray area, but I'll just share it anyway. A lot of between states, we are very conservative. So my providers and my pharmacist look over a bunch of small businesses throughout the entire United States. So I always say that we're very conservative and we follow the latest regulations. So when we do an IV, you're going to get your IV bag. There's certain things that you can put into the bag. A lot of times right now, you're having to get those in a push, but it's still through the IV, so it's one poke. But we do some injections. So injections are really great, meaning like it's going to go like a shot right into your muscle. And those are really great and convenient because an IV might take 45 minutes to an hour. An injection appointment is just going to be quick in and out, 10, 15 minutes. You can still get your vitamins, still get really great benefits. It's just oftentimes it can be like a convenience if you don't have time or even a financial thing, an IV can cost more money versus just a quick injection.
So what what types of substances, and I know this is a difficult question to answer because
Yeah.
you have such a wide offering, but what are they made of? Are they synthetic vitamins? Are they natural vitamins? What are they made of?
Yeah, so we use FDA regulated pharmacies, oftentimes like Olympia or Empower pharmacies. So those vitamins are made in the lab, and they get those in a very as best to a natural form that possibly can be made for your body. So it's not going to be exactly like from your fruits and your vegetables. It is going to be a synthetic vitamin, but it's going to be in its most natural form for your cells to utilize. So the benefit of getting those through an IV or in an injection is when you take an oral pill, you're going to have to break it down and try to absorb it into your body. And so there's different research studies out there. Sometimes you might absorb 20%, maybe you'll get 75%, but a lot of it can kind of depend on the person and what their gut health is and what their stress levels are. So when you get it in an injection, you're getting about 90% of that vitamin, and then in an IV, you're getting 100% where you can just have maximum benefits and receive that entire vitamin or supplement.
So one of the questions I get asked all the
Yeah,
time, and I just want to see how you handle this question because
put me on the spot.
we probably get the same questions on a lot of these things, but
Yeah.
what food can I eat more of to get that same thing? And like my argument is it's difficult to get the same amount of nutrition in today's foods. They're just not as nutritious.
Yeah, 100%. I actually had this conversation this morning with a client that came in, and I am a fan of supplementation because we live in this world where we struggle to have, spinach 25, 30 years ago is not the same spinach that we are getting today. So unless you are organically growing your own potatoes and raising your own cows, like your meat and your food sources are not going to be the same of what you get from the grocery store. And we can try really hard, even like reading labels and organically, like we're going to try our best. But oftentimes we're faced with financial, like things are expensive, they're hard to access. And so,
Mhm.
even when you try really hard to eat those whole foods, which are important, you're still going to miss every single thing that your body really needs to thrive and operate optimally.
I feel the same way. I saw a study here recently that showed, and I can't remember the exact numbers on this, but like from the 1950s to now, the food that was on the grocery store shelves, the produce has like 40% of the nutrition that it used to. It's crazy.
That
Our
is
soil is that depleted.
that is
Um,
wild.
so other questions on this is like, does somebody have to have a referral to you, or can they just call you?
Yeah, people can just call me. They do not have to have a referral. Our process is I will do an intake, and depending on exactly, maybe what someone's goals are or what they're wanting to learn about or get, majority of our process is the same. I will do an intake, a little health review, make sure that what you're looking for is a good fit for you, and then we do a telehealth call. So every patient sees one of our providers to make sure, again, that things are going to be safe and efficient for them. So we have an MD that orders their treatment essentially, and then we run things. We do not use insurance, so sometimes that's good or bad for people. But the benefit we do have is we do have a health savings account and flex spending, so people really like that benefit that we can accept.
So what kind of cost range is this, and how frequently do people have to come back? Is this like they come in one time and they're magically cured and
Yeah.
go on with their lives, or how frequently do they have to come back?
Yeah. I wish there could always be a one and done. So when we look at the best way that I can explain this and easy for people to understand is when we're looking at our health and our wellness, like if we go to the gym one time, or if we have that salad one time and we step on the scale, like it would be awesome to see that pound loss, right? But we know that we have to continuously move our bodies. We know that we have to continually feed ourselves, nutritious foods. We have to continuously be mindful of stress, right? So if we stop doing one of those things, things are going to become off. So when you're looking at getting supplementation, and I think that all the time people will be like, how long do I have to take this? I'm like, well, as long as you want, really. If you stop, things might slowly revert. So I feel like when people start to have progress, they tend to, and they do this at the gym too. You have progress, and then it's like, I don't know if I really need that anymore. And then they kind of drift away, and then they're like, crap, how did I get back to where I was?
We see it all the
So
time too.
yeah, right. So everybody's different. People will ask, like, how long does it actually last? Well, a lot of the vitamins are going to be water soluble, meaning your body's going to use them and get rid of what it doesn't need. So, and to note on that, I have had people say, well, that's just expensive pee, right? We're just going to pee that out. In a sense,
I've heard it before.
yes. Yeah, because they're water soluble. You're going to use what you
Mhm.
need and you're going to get rid of it. But I loved a doctor explain it to me once. When somebody is drinking alcohol, right? They they can feel the effects of alcohol or a hangover for days, right? Our body, we're not drinking it anymore, but we still feel those lasting effects. So the same thing goes for these vitamins when you're getting them into your body. Is yes, your cells are going to use exactly what it needs and get rid of it, but your organs and every other aspect of your body is going to have lasting effects of that vitamin from that one interaction. So, um, back to how often do I need to do it? It really depends on the person. If we have an athlete who's training hard for a marathon and they're sweating a lot, I do have some people that every week they come in and they get injections. But some people I have a lot of people that get an infusion before they travel. They're going to be flying, they're going to be exposed to different people, different germs. They want to just support their immune system. So they might only get it when they're kind of feeling down. I personally like to get one every 2 to 3 months just to help keep my hydration up. But I like to do injections every week. So um, a lot of it really goes on to how the person feels, what their health is currently like, are they taking other supplements? How does their diet look? All of those things kind of play a role into every person of how often do I need it?
It's amazing how fast stress will wreck things like that. Not like one night of not sleeping, or
Yeah.
one bout with like a stomach illness or different things like that. It can totally deplete you in a heartbeat.
Yes. Yes. Yeah. And I think, again, some of those easier things is to recognize or people to relate to is like going to the gym. Like if I don't go to the gym for a few days and then you go back, you're like, oh my gosh, I'm so tired. Like, it's just those couple days off that really can, derail you a little bit.
Yeah, no, I totally get that. So what you said something
Oh,
about offering a discount to patients that come through here.
yeah.
What kind of discount were you offering, and what do they need to do if they wanted to take advantage of that?
Yeah, absolutely. And I think I didn't answer your last question, so that triggered my memory. You had asked about cost.
Hmm.
So, and going along with that, so a lot of the injections, those range like your simple B12 shot is going to cost $20. Um, our immune shot, which is really great, or yeah, our cold defense shot, and then our allergy shot, most of those cost $30. So you're looking at $20 to $30 range for an injection. When you do see one of our physicians, there is a $25 telehealth fee. That does not have to be done every single time. So I always just tell people, it could be like once every 6 months that you have to do that. And then IV wise, your simple hydration is going to range from $89 up to $160. So kind of a variety there.
But that's
Majority
cheaper than the
range
ER.
cheaper than the ER. I
I've paid for
am
some of those, and they're not that cheap.
Yeah, yeah, absolutely. Cheaper than the ER, you guys, and much more comfortable. We'll say that too. You don't have to
Absolutely.
have those long wait lines. But we do, I have an office in Nebraska City, and then
Where is the
I love
office?
it is at 1240 North 19th Street, which is actually inside GG Wellness Center at the or at the hospital, at the gym. Um, so yeah, my office is right inside there. I rent an office, which is really great. What else? But we do offer mobile services. I have two other nurses that work with me, and we try to be accommodating. So if you, are feeling kind of crummy and you don't want to get out of your house, we can go to your house. I go to Ashland every other month for some corporate people who own a business. They work
That's
and
awesome.
get
I
their
didn't know you did
IV.
that.
Yeah, yeah. So that's kind of fun to be able to do that. Done some bachelor parties, bachelorette parties, wedding parties, and then I have a couple that just routinely like they make it a date night. So it's kind of fun too.
Interesting. Oh, no, that's awesome. Is there anything else that you thought we should cover?
I tried to make a list of like what do people usually ask? So two other things I would say, oftentimes people ask me what my hours are. And I just, you know what, I really love the time freedom that I have. So I don't necessarily have set hours. So you're not always going to find me sitting in my office waiting for somebody to walk in. I typically work off of a schedule. But the beauty of that is myself and then the two other nurses, we try really hard to accommodate to our patients and their needs.
So call
So
ahead is what you're saying.
yeah, so call ahead, but don't be shy to call on a weekend because Sunday I did 4 infusions that were not planned. So if I have the time, I'm gonna get you in as soon as I can. So that's always nice. But if I am in my office, also doors open, come on in, say, do you have time? And that often happens as well. And then the other question would be is age-wise. I have had that come up. People want to know how old do you have to be? And our doctors are comfortable. We treat 15 years and older.
That's a great question. That's one I didn't even think about asking. So
Yeah.
that's a great question. Um, but no, I personally know Amanda and have known her and her family for a long period of time. They're awesome people. I do highly recommend all of their stuff. So if you have questions, by all means, reach out to me or reach out to Amanda directly.
Oh yeah, and if you're coming from Jeff, just say I want Jeff's discount. I'm giving you guys 10% off for any of his referrals.
Even better.
Yeah, right?
So, yeah, Amanda, I really appreciate you coming on, taking the time to come on the call here and just kind of give my patient base an idea of what you offer and how that fits in
Absolutely.
with everything we do.
Yeah, I love that we're able to kind of collaborate and, being able to provide these types of services to people in our area, save them a trip from traveling is really awesome.
Yeah, awesome. I greatly appreciate you.
Yeah, thank you. I appreciate you having me on.